Happy New Year, everyone. Welcome and thank you for joining us for our first discussion this year on the South Sudanese Women Intellectuals Forum. My name is Dr. Anne Peter Lomole, and I am a pediatrician and I will be your moderator today. Today we will be discussing infertility and we will focus on societal views, management, and treatment. Infertility is a major issue in our society, and it is prevalent among both men and women, with every seventh couple in developed countries affected and every fourth couple in developing countries affected. Those affected experience a lot of stigma, especially women who are particularly targeted and blamed for infertility. Infertility should be considered not only as a medical problem, but also as a psychological and social problem due to the inability to fulfill one of the basic roles that is stated by our society, which is parenthood. Infertility treatment imposes a physical, mental, and emotional burden on all who are affected, and infertile couples struggle with stress, anxiety, and stigma. Management of infertility should focus on both men and women, and it should also focus on the psychological aspects associated with infertility. The community has a great role to play when it comes to reducing stigma that is directed towards either couples, women, or men who are affected by infertility. So today we will discuss the societal aspects and views on infertility. We will also talk about some of the medical aspects in terms of diagnosis, definitions, and treatments. And we will also talk about psychological and nutritional issues that affect fertility. We would like to thank our panelists for joining us today, and we would like to welcome our audience for those who have joined us before and those who are joining us for the first time. Thank you and welcome. This is an important discussion, and we hope that you'll be able to learn a lot from what we will discuss today. We are streaming live on Facebook and on YouTube. Feel free to share this on your various platforms and to ask questions. We will try and answer as many as we can. And for those that we can't, we will be able to go back and answer those questions after the discussion. We would also like to thank you and women who have offered us their support, and Aisha, who is currently behind the scenes as technical support. I will go straight into introducing our esteemed panelists who are here with us today. I would like to first introduce Dr. Idioro Joseph. Dr. Idioro is an obstetrician and gynecologist at the Mater Hospital in Nairobi. She has a bachelor's degree in medicine and surgery from the University of Juba and a master's of medicine in obstetrics and gynecology from the University of Nairobi. Dr. Idioro is currently pursuing her fellowship in gynecological oncology at the University of Nairobi. Next, I would like to introduce Ms. Benna Mark. Benna is a psychologist with specialization in counseling and health psychology. She has a master's degree in gender and governance and is currently a psychology PhD student in the area of trauma and community counseling. She is also the current head of department for the Department of Psychology and a full-time lecturer at the University of Juba. Welcome, Benna. Next, I would like to introduce Dr. Kiden Annette. Dr. Kiden is an obstetrics and gynecology resident at the University of Nairobi. She's currently doing her master's in medicine, and she works at the Kenyatta National Hospital, which is the premier referral hospital in Kenya. She has an undergraduate degree in medicine and surgery from Kampala International University, and she has a passion for women's health. I would also like to introduce Ms. Ganiri Jackslina, who is a nutritionist and a public health practitioner. She strongly believes that health is a lot more dependent on our habits and nutrition than medicine. She has a specialized interest in nutritional care and expertise in infant and young child feeding. She has worked at Yambio State Hospital. She has also worked with World Vision International and also at the Mbagathi District Hospital in Kenya. Ms. Ganiri holds a Bachelor of Science first-class degree in human nutrition and dietetics from the Kenya Methodist University and a master's degree in public health from Clark International University. Welcome, Ms. Ganiri. Finally, I would like to introduce Ms. Lily Vasaronga. Ms. Lily is a gender and mental health specialist. She has more than 10 years experience as a humanitarian worker in South Sudan and about 3 years experience in mental health. She graduated from the University of Birmingham with a master's degree in international relations and gender in the UK in 2016, and from Cavendish University in Uganda with a bachelor's degree in business administration and procurement. She worked with World Vision International as an administrator and in the Ministry of Interior in Juba, South Sudan. She advocates for people with mental health to integrate into the community and to start living a life free of stigma. She also actively participates in the promotion of girls' education and advocates against gender-based violence. Thank you so much, our panelists, for taking the time to join us today. We are so grateful for your presence and for the fact that you have agreed to share your knowledge and your skills and experiences with us on this forum today. And thank you to the audience who are listening in. We will be expecting questions from you, and we will go straight ahead into some of the questions that we wanted to ask the panelists. And we'll start with you, Dr. Kiden. You'll set the stage for us. Could you please define for us, if you could unmute yourself, Dr. Kiden, the first question is for you. Could you please define for us what infertility is and give us some figures on the prevalence? Is there any comparison between men and women? Is there a difference, and why the difference? And if you have any figures for South Sudan in comparison to figures in Africa and the world, you could also give us a few pointers on that and the reason for any differences. So definition of infertility, prevalence of infertility, difference in statistics when it comes to women and men, and in terms of regional comparisons, what is it that has been seen in terms of statistics? Thank you.
Thank you very much, everyone, for having me in this forum. It is indeed a privilege to talk about this topic, infertility, which has been with us for such a very long time, and it has caused a lot of havoc in the community. And as we discuss, you will realize that it is indeed an emotional topic, so to say. I will go straight forward to define what infertility is. So now infertility, medically, we define it as a failure to conceive after one full year of unprotected and regular intercourse in a young couple. So there are very important terms that I have used there. This must be regular. Regularity here I refer to at least you should be able to engage in a sexual activity between a woman and a man, and this should take place at least 2 to 4 times in a week. So it shouldn't be something that is sporadic, that you just do it maybe when you have come away from your place of work over the weekend, or you have gotten some holiday, you are working in the South Sudan, hustling there, your wife is in Nairobi, and then you come once in a while. When that takes place, then if you do not conceive, we don't place you under the category of those that are considered to be infertile after 1 year, right? So the other thing is that I have mentioned something about the age, particularly the age of the lady or the mother to be. You realize that scientifically an age more than 35 years of age, there is what we call the ovarian reserve. The ovaries the amount of follicles inside there will go down. And so when we are defining the infertility, we put into perspective the age of the woman. So what is the prevalence of infertility? You realize that studies have shown different prevalences in different geographical locations. But worldwide, it is estimated that approximately 15% of the married couples or of people are infertile. So you see, the percentage is really, really big. And so it is a common problem. So as you tackle it, you should know that so many people are being affected. And so the problem is not only with you. There are so many people. Imagine 15% of the population worldwide are experiencing some difficulty in conception. So that is that. I looked at the statistics in South Sudan, and unfortunately, we don't have data. And then, but in 2018, there was a study that was done in the Sudan, and you see that is, we are no longer there. If they choose to put us in their statistics, that would be grace. So approximately 11.5% of the population in adult population that are in the childbearing age are accounting to 11.5%. So still, it is very, very big, right? So prevalences between women and men, women account, or female factors for that matter, account for 40 to 55% of all the causes or all the cases of infertility. And for the men, they account to 30 to 40% of couples that are infertile. Then when you combine, sometimes you realize that there are couples that are both the mother and the father, or the man and the husband, the husband and the woman, both of them have problems with infertility, or they have identifiable causes of infertility. That will account for approximately 10 to 15%. So, as I have said, that the statistics vary regionally. So for that, have I answered everything?
Thank you so much, Dr. Kiden. I think you've answered very well. I like that first definition of yours, that people have to take into account that couples who do not actually live together cannot fit within that definition, especially if they've not been together for long periods of time. Infertility would be defined in couples who are actually having sexual relations frequently, for that to be determined as infertility. And I think for many of our people, due to the fact that our families are sort of scattered all over the place, the women may be working in East Africa, and the men might be working in South Sudan, or even in some women are working in Australia or in the diaspora. And that physical distance prevents them from actually consummating or having activities that might lead to children, and therefore that cannot fall within the definition. I like the fact that you have made that clear. And from the statistics that you've given us, it seems that the difference is not that huge. When you're talking about female factors and you're talking about male factors, you said about 40% in female on the lower end and 35% in men, and both of them being 10%. And I think that already sets the stage that women cannot be blamed, or the way the community works is that women are blamed completely when it comes to fertility issues. But you can see there's quite a high proportion that is associated with the male fertility. Thank you so much, Dr. Kidem. Now, we'll just go on a little bit with you. So if you could please also explain to us whether there are different types of infertility. Is there like a categorization? And if there is, why? And what are the reasons or causes for the different types of infertility? What are the main causes that you have come across for infertility? And what are some of the factors that contribute, basically like risk factors that contribute to infertility that you are aware of? If you could just give us those details. Thank you.
All right, thank you once again. Infertility, we do classify it into two main categories. We have what we call the primary infertility and the secondary infertility. Primary infertility is where a couple has never conceived at all. From the time they are married, from the time they are engaged in regular sexual intercourse between man and woman, until to the time of diagnosis. And they have been trying to do so. They have never achieved a pregnancy. So that is primary. Secondary infertility is where a woman has ever conceived or a man has ever made a woman pregnant, but irrespective of the outcome of that pregnancy, whether it was a live birth or a good outcome, or it resulted into a miscarriage or an ectopic pregnancy, that we call it as a secondary infertility, because the woman has ever conceived. But thereafter, when you try to conceive again, you don't achieve pregnancy. So you have ever conceived, irrespective of the outcome, but later on when you desire another pregnancy, it does not occur. So when that happens, we call it as a secondary infertility. Or the other question was the causes. Yeah, the causes of infertility. These ones we as we had already seen earlier on, that it is there are the female factors and the male factors. So in both of them, there are things that are in common. We have got the gametes, which are generated from the ovaries or from the testes. So when we are looking at infertility, we first look at, are there gametes that are formed, whether it be a woman or a man? And if these gametes are formed, are they of good quality to give us babies? And after being formed, then there is the transportation from wherever they are manufactured from the ovaries, of course, and then down to where the fertilization takes place, and then finally to where the baby grows in the uterus. So you see, the causes of infertility are basically grouped into that order. From the gametes being formed from the ovaries, or then it comes down to the transportation, then growth, where it grows. So for the men, we have got the testes, where the sperms are made. That process is controlled by hormones and many physiological factors that take place that regulate the process of the sperm formation. So if there is anything that goes wrong in that process, that will result into infertility. Sometimes the formation can be there and it is little. Is it enough? Yeah. Are they normal in shape? Are they able to move? Do we have enough of them? So that is basically from the industry, from the factory, where these lives are being made from the very beginning. Then that is in the testes. So problems can arise after everything has been put in order inside the industry, like transportation. You can get a roadblock as the sperms are trying to maneuver their way and coming out into the female genital tract. If there is any problem that causes obstruction, that is where a big issue can occur. Then, issues also to do with coitus. Sometimes people fail to have intercourse, not because that there is any obstruction along the way, but simply because there is an erectile dysfunction. Maybe it could be, when that happens, then it means that the sperms cannot be put inside the female genital tract where they can travel and go to fertilize the egg. So issues with coitus. It could be that the urethral meatus, or where the sperms finally get out, is poorly located in a very wrong place, what we call hypospadias or congenital malformations of the penis. And then these sperms cannot go where they're supposed to, because they are supposed to be deposited at the cervical end of the female genital tract. And then also it can be idiopathic, what we don't know the reason as to why there is infertility. So for the men, that is that. So for the ladies, we after the ovaries have already manufactured the ova, or the eggs for that matter. If the process of oogenesis or formation of those ova is perfect and well, that is very good. Still, the ova has to move. It has to come out of the ovary, enter into the fallopian tube, finally fertilize to the uterus. So if there are problems along the way or in the manufacturing, then problems can arise. So that is what I would say for now, Anne.
Thank you, Dr. Kiden. I like the way you explain things. You know, very simple. Talking about the factory, the constituents that are needed in terms of materials for that factory to work the way it's supposed to, and also the transport mechanism. I think that is amazing. The way you've broken it down, even someone without a medical background can understand what you're saying. Thank you so much for that explanation. So we'll go to Miss Lily. Miss Lily, you're here representing the societal and gender aspects of this discussion. And I am sure you have come across, Dr. Kiden has talked to us about the science in terms of what some of the reasons are that a man or a woman might be infertile. But what are the myths, or what are the things that we hear in society about infertility, if any, that you have come across? And what are some of the reasons that you think those myths are being passed around in our societies? Have you come across any myths related to infertility? Miss Lily.
Sensitive, and it's a very rare topics that hardly spoken about in our communities. It's while infertility is actually a disease, it can affect every person in our community or in our society. It is something that it's something that we live with. It can affect us psychologically or emotionally, although it's not only a psychological disease, it's a mental condition that people live with. It can, with lives, really, when you are infertile, it dramatizes someone's life. We go through stress, you find like depression, anxiety. You also have like somebody's very hopeless, find like there's no life anymore with no child, worthlessness, you name them. Coming to the myths, there are various myths around infertility in our communities. One is just like infertility is just, it looks the same, it's the same journey. Like that's what people, which is not really true. There's a lot of myths around it. People think at times they give like undesirable advice to people who, the partners who cannot conceive. And at times it's not really helpful because they think it's just the same. It's the same journey. Then the other one is just somebody who just like relax. It's just like, it is something to relax about it, which is true. Relaxing can be like psychological or infertility or that caused by chronic stress, which can be true. But however, infertility is actually not a physical disease. It's actually it's actually the disease, that a condition that people undermine it. It's a medical conditions, but they think, oh, relax. And somebody who have been like relaxing, are you relaxing only about the mind? And yet it's something that you need to seek medical medical advice about it and see how you can cure it. But people just say, no, just relax, pass time, you will get it, you'll get there. And the years, the months pass like that. Then the other myth is like, they say, work harder, try harder. So partners who have been like trying very hard, like people think like they are not really trying because there's silence about it, but the myth is like, keep on trying, try harder. So at times you find couples who, they tell them that try harder. It demoralizes them so much to the extent that at times they're like, untimely, how do we try? Because this somebody has been trying and they're telling them try, keep on trying, which is something simple that cannot, it's actually something that we cannot control. It's a disease that we live, it's a medical condition that we live with, that is not about only, there's no way we can control unless we seek advice or medical attention about it. And again, it's like fertility is all about women. They say, oh, it's a women thing. But people don't actually think that it takes two people to make a child. A man and a female and a man has been affected the same way. It's not only female. Then the other one is they say, oh, it's the age. Women normally, when they're aged, their sexuality decrease, which is, it might be true that as they age, their sexuality is decreasing, but it's not true, because as well as the men also age, their sexuality decreases or increases. Infertility actually increases within men, because as you doctor was saying at times, the sperm, they might not be producing enough sperm because of the age. But here they say, oh, it's a woman thing. Then the other one is like, oh, they have ever given birth before. So if they have given birth, so just relax, time will come, but which is not true. It might be, yes, true, because she has been some years back. But there's also a secondary infertility, just like the doctor made it. In secondary fertility, is like you can give a birth to a child. I have an experience with, I had a neighbor back home. She gave birth when she was in her late 20s, and she stayed for 12 years. She forgot. She never knew she would get birth again. So it was like, it's not only that you only try or you seek medical when like they are saying, oh, with the age you cannot, maybe with time you have already given birth, maybe you don't have any other kids again. No, but try to seek. It's not true that once you have given birth, meaning God only gave you one child. you have more. But you might be going through a problem. But they say, oh no, she already gave birth. That was the last seed she had. So, which is not true. The other one is like the health. They say it's all about her health. And it's about her health, so does not impact fertility, which is not true. If I'm not healthy, then meaning I have, both of us has to seek medical advice. If maybe that's why I'm not doing good. Maybe that's why there might be a problem with my uterus. There might be a problem with my husband. Maybe he's not producing enough sperm. But they say, oh, it doesn't matter. The infertility does not matter how healthy, or it does not impact, actually. The else part of it does not impact infertility, which is not true. So those are the few that I got, the few means that I got from like looking around our community, and even with the international world is the same means, because they're like, oh, it's all about women. But it's not about women, it's for both men and for female and men, because it takes two people to make a child.
Yeah.
Thank you.
Very true, Lily. I think, as we had said before, what Dr. Kiden had said about the statistics, it's quite clear that it's not only a female issue, as our society has for a long time made it to look, and for us to say that it is stress or that people are not trying hard enough, it's like we are looking at their experience and not really taking it at the level of impact it has on their lives. And it shows that we are not even trying to stand in their shoes. We're not being empathetic about what is going on in their lives. And that is something that we need to take into account, that the truth is, for many cases of infertility, it's important to seek help. And later on, Dr. Kiden will talk to us about how it's diagnosed. It's important to seek help because it could be it could most likely be a physical issue. Some can be corrected, some can't, but the options can be given by the doctors who are able to tell what the reasons behind it is. So, Dr. Idioro, I don't know if you can come on screen. Okay, thank you, Dr. Idioro. I'll go to you next because Lily has talked about some of the myths that have been associated with infertility in our society. And something I've come across also is that people seem to think that contraceptions also contributes to infertility. And I would like you to give like a scientific sort of like a scientific view on that. Are contraceptives or contraception, is it associated with infertility? And if yes, how do they contribute? And what do you advise? Is this a myth or this is an actual thing from a scientific point of view? Dr. Idioro.
Thank you, Anne, for hosting me today. Concerning contraception and infertility, I think worldwide this is one of the widely researched issue concerning contraceptives and infertility. And the fact is contraceptives don't contribute to infertility. Actually, women on contraception, like 21% of them will conceive within the first month of stopping the contraception, and almost 76% will conceive within the first year. So that is more than 90%. So I think basically contraceptive doesn't. Yeah.
Thank you, Dr. Idioro. I think that is something that probably we needed to clear, because I think very many people, even most of us women think, or even the men think that if a woman uses contraception, then if she then is unable to have children, then the contraceptives are to blame. But as Dr. Idioro has said, there are many studies that have been done according on that particular topic, and most of them have really not shown any relation to causation of infertility. But of course, in medicine, you can never say never, but most of the studies have actually shown that there has been no relationship with that. So I will go next to Miss Benna. Benna, if you can unmute yourself. Lily talked in the initial statement she made, she talked a lot about some of the psychological issues that affect couples or individuals who are affected by infertility. And I think even as doctors, for most of us, that is one of the things we really ignore when it comes to managing people with infertility. So could you please just give us an overview of what they refer to as the crisis of infertility, and what is the psychological impact of infertility on those affected and on the family units? And just expound for us, do women experience it differently as compared to men? And why is that? Thank you, Ms. Benna.
All right, Happy New Year to everybody. I'm pleased to be in this panel. Actually, this topic of discussion is very vital. And to break it down to our context, in South Sudan or in the world of women, infertility has become one of the world war to women's life. Women have been subjected and have been abandoned because of the infertility, based on their own perceptions on what is called infertility. And people have forgotten actually that two people brings a being in this world. To come to the concept of South Sudan in a special way, Dr. Annette already said the research has not been done. There are no statistics that say the number of women who are infertile in South Sudan, and it is right. In my own observation as the person who is living in South Sudan, there is a lot of problems within the arena of women concerning the infertility. It has brought a lot of questions in the mind of people and the families. Sometimes you question yourself, why I got married and I am not, I've not conceived. You will start to hear a lot of blah, blah, blah things. And such kind of blah, blah, let me just say blah, blah, because they are not good. The more you start to hear about the blah, blah, what will happen to your mind? Of course, a lot of stress. When we talk about this infertility in South Sudan context, many women are affected. And when we talk about a single individual, it means also that the whole family is affected. Put yourself into the shoe of a mother of a lady who got married within a year and she has not yet conceived. What happened to both? That is trauma, major trauma. And when you talk about trauma, we talk about the first person who is the lady and the mother or the family members. Fertility is the problem. We know that infertility affects women biologically, as Dr. Annette said it in a very good way. I enjoyed the lectures. I love that one. And then also psychologically and socially. When I talk about the psychological perspective of infertility, it means that the couples that goes through this, situation of infertility, we know that couple experience some of the psychological disorders, such as like maybe lack of sexual, satisfaction, and the lack of marital satisfaction, of course.
Sorry, Benna, I think you have sort of frozen there. I don't know if, yeah, I'm sorry, we seem to have lost Benna there a little bit, but when she's back, she'll just continue to explain to us some of those psychological impacts of infertility and even the diagnosis of infertility on those who are affected. I can see, I wanted to ask Dr. Ganiri some questions, but it seems, oh, you're back. Okay, Ganiri, you're back on screen. So, Ganiri, you're here basically to talk about mostly the nutrition aspects when it comes to infertility. And I know that this is something people don't think about when it comes to infertility. They don't think that nutrition plays a major role. We're here to show us and demystify why nutrition is important when it comes to fertility, management of fertility, and if there is actually a relationship between diet and fertility. Daniel.
Thank you so much, and Happy New Year to everyone. I'm happy to be here. There is a lot of relationship between diet and fertility or infertility, and for any healthy human, we need to have a balanced diet, and we know very well the other aspects of having irregular diet or the poor eating habits that may end up having effect on our health, and this means that we need to have a proper nutrition for a good fertility. For us, for a lady or a couple to have to be able to conceive, there are other aspects that have to be outside the way. We shall later on talk about overweight and also anorexia or other substances that may end up having effect on the fertility of the couple generally. So it's always good to have a balanced diet, concentrating more on our fruits and vegetables, and also reducing on the fats. We have seen the effect of the fats on the body. For example, a lot of fatty tissues may have effect on the hormone balances. So it's always good to have the healthy eating, and also we know very well when there is a lot of fatty tissues around the testes, there's a lot of heat produced, so the sperm count is also reduced, or actually there is a decrease in the production of sperms, just because around the testes is a lot of heat due to having a lot of fatty tissues. We also have seen about the society, how they perceive nutrition as an aspect to health. It tends to be that men, in some society, everything healthy is for the men. The good eggs, the chicken, you just turn the saucepan and maybe stay with some leftovers in the saucepan. And women are subjected to eat the carbohydrates, the acida. They don't have the good nutritional proteins. I know very well a cell is made up of a protein for the eggs for the women. So, and also for the man. So it's just it's very important for a woman to have enough proteins for the cells to be available and in good numbers, and also for a proper ovulation and menstrual cycle. We have also known that before a woman can be able to conceive, it's advisable for some cases to go through supplementation, especially of folic acid, prior as a parent to get pregnant, maybe to conceive. So it does not necessarily mean that you have to go into it to have the supplements. What if it's not there? But once you have a diet of variety of vegetables and fruits, you'll be able to get that folic acid eventually. We have seen in the society where, like in a society, they will tell you when you eat bananas that are joined together, you have high chances of giving birth to twins, which is something good because the lady end up eating 2 bananas instead of 1, so her vitamin levels is increased a little bit. So it's also important for us to believe that or to take into considerations that it does not stop at conception of a child. There is more after conception. So if the woman is not nutritionally okay, with a good BMI of around 18 to around 24, it will affect the baby as well. We have seen the neurotype defects due to folic acid, maybe alcohol syndromes because of drinking alcohol prior to delivery, or even conception, So low having anemia prior to conception, or it can actually hinder conception. So it's not just that we have to think about the getting for a woman and nutrition. It's a longer process. What it starts from prior to conception and also after conception, what will happen to the baby? Yeah.
Thank you so much, Ganiri. I think later on you will expound on some of the substances. You've mentioned alcohol that may affect fertility and how we can adjust our diets to basically be at a position where if fertilization occurs, then we're able to have healthy babies and the babies are able to grow well in the womb. I'll go back to Benna. She was giving us an overview of some of the psychological impact of infertility on those affected. And also she was about to tell us whether men and women experience it differently and why. Benna.
We all know that men and women experience infertility or the impact of infertility differently. Of course, in our nature, a woman is the one to carry the child in her womb for 9 months, then later out. This is our belief as human beings. But also, men experience the same as women. When we talk about those psychological impact on how men and women are experiencing infertility, when we talk about these distresses and even depression, anxiety, self-esteem, somatic complaints, reduction in libido, and other, like for instance, self-blames. You know, sometimes it is very hard in the society, or the society that got no any ideas about how to handle such kind of problems in life. We all blame women in that perspective because women in other cultures are called the mother of the nature. Yes, we believe in that, but also the nature will be called as the presence of a human being through the two people, the man and a female. Women experience the same as men, but the reaction differs. You know, men, they don't care. In our own perspective, they don't care because they always blame women. Though when we go to medical checkup, like we go to the doctors and check out who is the problem, later on you will find that the man is the one who has problems. I have a story. There was a woman down there who experienced that kind of infertility for a quite long time. The whole family was blaming her, included her own family. So, you know, when human being, when we are in problem, we always think of the second plan, which is the plan B. Of course, in the nature of a woman, with the depression, with the low self-esteem and all anxiety about fearing about the infertility, like for instance, everybody is, you know, laughing at me because I got no child or I cannot even produce and all that. Of course, the negative thoughts always capture the brain of a woman, because we always think with emotions. The more we find ourselves emotional, then always negative decisions comes. You know, that woman decided to quit that marriage, and she, within half of the year, she got pregnant. What happened? The whole world started to say something. Oh, it means it was not our girl, it was not our daughter, it was no, blah, 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 blah. So a lot of havoc within the family was not in a good way, and then it has given a very bad image to the two families. What do I mean by this? I mean that not only psychological impact, we should also put on our own social ideology towards the issue of infertility. Sometimes also we think of how we handle our relationship with our partners. Relationship also burns everything that we have in our mind. Actually, when we go further a bit, let me just go a bit in theory. In psychoanalysis, in 1940s, there was a study being carried that infertility is the cause of that subconscious of a woman. For instance, a woman or a man who denied to become a father or a mother. You deny, there is a self-denial to become a mother or a denial to motherhood. I don't want to go too much into psychoanalysis, but let me just break it down. Problems or psychological impacts of of infertility, it is not only about when we think that it is only about the distress or what anxiety and all that, but we should also see our social settings. Huh? We see in our own self. Sometimes also we look into our own historical background. I would rather say maybe it's like a question to Dr. Is genetic. I would like to know, maybe some other people down there wanted to know also about this one, because people have their own perceptions, the way they think about infertility in their own traditional way. I think it is good for people to be psycho-educated about this issue of this infertility. We know that anything that may trigger anything in human's body is from the brain. We all believe that the brain is the center of our body. Hence, if this brain is disturbed, do you think that the fertility may take place? No. First thing we need to know that we need to keep this brain safe from all the distresses, anxiety, and all that. You know, sometimes we think of big things, but there are small issues that may even pave for us a way of how to fight such kind of things. I think psychologically, when we are healthy, it means also physically we'll be healthy.
Thank you so much, Donna. You have raised an important point that the brain controls much of our body, and therefore, if it's affected by anything external, it might influence to some extent. It can't be the only reason for infertility, but it might influence to some extent. And I think even Dr. Kiden has talked about libido. Lily has talked about the way sometimes stress can, yes, influence fertility, but it should not be put as the major reason for it. But it is definitely a contributing factor. Thank you for that. So we'll go back to Kiden. Kiden, there's a question that I feel is very important to ask when it comes to infertility and the causes of infertility. One of the most common things that is blamed for infertility are sexually transmitted infections. And these are things that we can actually prevent in terms of with our behavior and probably even with barrier methods. But it's something that has not really been, in terms of our society, we don't link it with infertility. I'd like you to give us the link between STIs and infertility, and which specific STIs may lead to infertility, and how these are diagnosed and treated, and why treatment and prevention is important. And as you finish with the STIs, maybe you can also describe some of the tests that are used to diagnose infertility in women specifically. Then we will talk about the men later. So STIs and the association with infertility, and diagnosis and treatment, and why prevention is important. Kiden, if you can unmute yourself, thank you.
All right. Thank you very much, Anne, for that question. Indeed, STIs contribute a major percentage towards infertility, more especially in the women. So we have got quite a number of STIs, but there are two important ones that have got a significant effect on the anatomy of the female genital or the female reproductive system. Those are what we call the chlamydia infections, and we have also gonorrhea, as well as the syphilis. So how do they bring about infertility? What happens is that most of the time, these infections, when they affect the woman, they are asymptomatic, or you realize that they don't show symptoms. all right? They don't show symptoms. In other words, it is silent. You get it, and you go through it while you didn't know that you have actually acquired the infection. And even when you have some symptoms, they are vague symptoms. They are non-specific. It can present like any other thing. Like, for example, it can present like burning sensation during urination. It can present like a fever. It can present like a discharge. So at the end of the day, you really do not know that it is you are suffering from a chlamydia infection or a gonorrhea. So you see, with chlamydia in particular, 75% of these patients are asymptomatic. It will end up causing a lot of inflammation within the genital tract, and yet you are not aware. You see, that is where the catch is. And many people are taken up by surprise that they are not conceiving because they suffered in their time, in their lifetime, from a chlamydia infection or a gonorrhea. So the reason why they are very important, what does it really, how does the effect come about? What happens is that there is a lot of an inflammatory process that takes place within the fallopian tubes. It could be within the uterus and in the pelvis or in the abdominal cavity or in the pelvic cavity, to be specific. An inflammatory process takes place, and if you treat it early, then the inflammation will be minimal. But if you don't treat it and you fall among those ones that are asymptomatic and yet something significant has occurred, then the healing that takes place by fibrosis. It forms a scar tissue. It forms adhesions. And these adhesions will cause structural abnormalities or anatomical distortion of the fallopian tubes or the uterus, whatever it is where those scar tissues are formed. And when that happens, it means that, remember I had told you earlier on that the transportation of these gametes from the sex organs, that is the ovary or the testes, is a very major important factor in causation of infertility. So when the fallopian tube is fibrotic, it means that the egg will not come to where it's supposed to go. It will not pass through. Then when that happens, it means that no baby, therefore infertility results. So it is very important that if we can avoid these STIs in one way or the other, one, make sure that you have got only one sexual partner, or the other thing is that if you feel that you really can't help it, use some condoms or something like that. You try to prevent the infection. If the infection occurred, then early diagnosis and treatment is important, such that we reduce on the inflammation that takes place and leading into adhesions and hence infertility or blockade of the tubes. Yes, so that is very important that we do diagnose it early and make sure that it is treated. Now, importantly with the treatment, it is important that you complete and comply with your treatment. The treatment must be complete, right? We have got good antibiotics that can handle that bacterial infection, and then it will relieve you when you are in a better way. Sometimes it is important also to make sure that you involving your partner in the treatment of these STIs, because reinfection can occur. If you have acquired the infection, you are treated and your partner is not treated, and then he will reinfect you, and the infection comes again and cause more damage to your body. So make sure that you complete your treatment. Secondly, your partner should be treated alongside with you. Then it is important that when we are treating these infections, make sure that you treat both the chlamydia and the gonorrhea and the syphilis, because they love traveling together and their effect is always the same, causing infertility. Sometimes pregnancy can occur, but what happened is that because of the blockage, the pregnancy will grow in a wrong place, what we call ectopic pregnancy. And that is equally problematic. Actually, it is life-threatening to the mother, because when the tubes burst, she experiences a lot of hemorrhage. And if there is no surgery that can be done very fast, then the life of the mother is in jeopardy. So that is how important it is that we should be able to treat these STIs with the seriousness. You see, sometimes we can see these discharges coming through, your body is not well, or you experience a lot of pains during sexual intercourse, pelvic pain, and you don't take it to be a matter. Please do, because it is very, very important, right? So, with infertility in women, how do we diagnose it? Usually what happened is that we first take the history from you, what we call history taking, and then we do physical exam. From your story, it gives us a point as to where the problem is, right? And then when we examine your body, we will be able to find some physical features that may point us to where the problem could be. As somebody has said, I don't know who it was, that weight, yes, I think it is Ben. Who is the, all right, whoever it is, said it. Weight, if you have a BMI that is at the roof, right? So it has got a major effect on your fertility, and you will be able to look at that from where you are presenting, and we say probably if she's not conceiving, this would be the problem. And there we take the investigations that would help us to diagnose where exactly the problem is. So generally in the investigations in women, we look at it is from the history, and then the laboratory investigations, then the radiological investigations. Among those ones, I think we have got what we have the ultrasound, because when we want to look at the anatomy of the uterus, is it normal? Is it normal? What is happening inside there? Would there be some fibroids that are growing in there and occupying the whole space? And we could pick that up with an ultrasound. And then we have got what we call the histosalpingography, where we inject in a dye, and this how helps us to outline the uterine cavity. How does it look like? Does it have masses? Does it have defects in there? Does it have adhesions in there? Is it patent? So we look at the uterine cavity as well as the fallopian tubes, and that will help us to identify if there is any structural difficulty causing us not to conceive. Another thing is also what we hold the hysteroscopy, where we use cameras to look inside the uterus, and that helps also in a way or the other. And then there is one important cause of infertility, something called endometriosis. That is very, very, very important for us to take note of. Endometriosis simply means that the uterus, the uterine cavity, or the endometrium, what we call the endometrium, that tissue, instead of being confined inside the uterine cavity, it begins to proliferate or to grow from somewhere else, and that causes a lot of scarring. Sometimes it can go up to the ovaries, affecting ovulation itself. So we have got a gold standard, what we call the laparoscopic surgery, where we look inside, and many times we do find women with a lot of endometriosis, and causing adhesions, and hence your tubes can be affected and many other things inside there. So then we can also do hormonal profiles where we look at the ovarian function, whether the ovaries are really functioning very well. Does the ovary have got enough follicles that should come out and produce eggs? Are they enough there? So we do that when we do what is called the hormonal profile, and sometimes we also do. You see, by the time the ovary usually waits for an instruction. That instruction comes from the brain, from a gland called the pituitary gland, and also from the hypothalamus. So we look at that and we analyze these hormones that regulate the gamete formation. So those are some of the investigations that we can make. And then for the men, how do you diagnose infertility? The most common one is when we are doing what is called seminalysis. All right, seminalysis is where you look at a sample of the semen that is produced. We look at the volume, how much is it? Sometimes men may not be able to generate enough of that. At least you should be able to have 2 mils per ejaculation, 2 mils of that semen. The amount, how many sperms are alive in there. You see, we analyze all those. How do the structural formation or the physiological, how do they look like? All right. Yeah. How do they look like? Sometimes are they normal? Do they have the tail to propel them to go forward? Are they able to move? Are they alive? Do they have enough food in there? You see? So you analyze all that, and at the end of the day, a very big percentage of men that have got this particular issue. So seminalysis is one of the major investigations that we usually carry out. Even when it is the woman that has come to report that there is infertility and the man has shied away, we will insist, bring him, we need to see whether there is an issue there, please. And then those men who are listening to us, please comply and come along with our mothers to do this simple investigation that we usually carry out. And then the other thing is that we also look at the structure. Somebody has mentioned that one test is, but the most important thing is, even when it is one test, is it functioning? And sometimes the tests are not there, you see. And they could have remained inside the abdominal cavity, and they have not come to where they are supposed to abide or to stay in the scrotum. So we can do an ultrasound to locate where those testes are, and ideally they are supposed to have descended by birth. A good number of boys are born when they have not descended, but they do descend, and so they are supposed to be in the correct places. So ultrasound can also be done for men. So I think apparently for that, let me, there is this question, some of the infections hereditary? Some of the infections, are they hereditary? Yes, sometimes they are, but most of them are acquired. Some of them are acquired, like the mumps, which most of the time I think most children had them in childhood. Mumps are just these swellings that usually affect some glands around here, and then it can go down to the testes, and they can cause significant destruction of where the germinal cells are in the testes. So some of the infections can do affect. Yes.
Thank you, Kiden. I will give a small perspective here. Dr. Kiden has talked about moms, and therefore that emphasizes the need for vaccination, okay, of children. There's a vaccine actually covers for that. Then the other thing is she's talked about that sometimes the testes might be intra-abdominal inside the stomach. They haven't gone down to where they're supposed to be in the sacs. And one of the roles of the pediatricians or the people who are assessing children when they're born is to actually check that the testis has gotten into the scrotum. Sometimes it takes them longer to get there, but it's important to check for them so that you're able to investigate early and hopefully even do surgeries to bring them down to the scrotum if they haven't descended by the time that they're supposed to. So thank you so much, Dr. Kiden, for that. Next, we will go to Dr. Idoro. Dr. Idoro, please just give us a brief overview of treatment and follow-up in both males and females. If you can talk about assisted reproductive technologies and describe for us if there's any stigma actually associated with fertility treatments. And maybe you can also mention a few of the effects of some of the treatments used and how these are managed. So how is infertility managed and follow-up, some information on assisted reproductive technologies and stigma, and also the consequences and effects of some of these treatments. Probably we can limit our answers to about 5 minutes so that we're able to finish the discussion on time. Thank you, Dr. Idioro.
Okay, thank you once again. I'm sorry, I'm at work. That is why and there are some consultations going around, so I always get out of the screen. Infertility, like it has been said by Dr. Kiden, actually the investigations begins early. Like for us women, after giving birth to a boy child, it's actually like where there are no pediatricians who check the babies. It's actually the job of the mother to make sure the testicles are there in the scrotum. So usually our mothers, and I advise everyone who is now watching that whenever you give or someone gives birth to a boy child, the first thing is to check the testicles, whether they are in the scrotum or not in the scrotum, so that, as Anna said, investigations can be done early and we can rescue the situation. Again, immunization is important. This is all for male investigations. Like Kiden said, it's only one test, but that one test is like accumulation of so many things which has happened to the male child, that and the end result is what shows in the semen, whether the sperms are there or the sperms are not there, whether the testicles are active or not active. So usually when a couple walk in a fertility clinic, so we actually first thing we do counseling. You counsel them and you tell them how difficult it is, and it needs patience to investigate. So, and you actually, from the history and clinical exams are the baseline of everything, you might end up finding the woman stays somewhere in South Sudan, the man is in America, he comes once in a while, and you're being told that you are infertile, and you have not even stayed together. So like in the definition of fertility, we need active sexual activity, which is at least sexual intercourse 2 to 3 times a week. I know when I say that, people say, but actually regular sexual activity is 2 to 3 times per week. And we will consider there is infertility after 1 year of that without any contraception. So if you come like after 6 months of marriage that have not gotten pregnant, I will tell you, please still, there is no hurry. Is the man there? Have you stayed together for long enough? Maybe they have just married, they are trying to settle, one is working in another county, another one is on the other side. So we still have to bring things together and make sure that they are actually together and sex is happening before we consider there is infertility. Then for women, now for men, when we find there is issue with the sperms, nowadays there are some medications which most of the time they are supplements, of zinc and vitamin E, which are given to the men depending on the condition. If the sperm count is less, then this one can be rescued. But if there is no sperm at all, now the treatment is we advise them on donor sperm if the issue is not there, the lady. And for the female, if the issue, like from the investigations, the problem is from the tube. The tube can be opened through laparoscopy. So we might try that, although the success rate is less than 60%, but still we can give it a try and open the tube. Then if all fail, then the final resort is IVF, which is in utero fertilization. So IVF actually is done whereby fertilization is done outside, then it is transferred. Once fertilization has happened, then the embryo is transferred to the woman's womb. There are so many types of, in case of the sperm is less, there is something also which is called intrauterine insemination, whereby the little sperm which is there will be taken and put inside the uterus for fertilization to happen. So actually it involves a lot of procedures until when the eggs are ready, then you inseminate the sperms. Now when it comes to stigma, there is a lot of stigma which is associated with fertility treatment. At first, like when we speak about in the context of South Sudan society, like everyone has mentioned earlier, everything is the woman. So like Lily mentioned about the age. Even if the lady is young and she's married, in the context of South Sudan, when was she even born? Do you know when she was born? She is even very old. Even if you are young, and again, things like, she has given birth before. I think even she's already old, she will not be able to give birth again. Instead of assisting the couple to seek like medical advice, now people are insulting, then distress gets in, and with distress again, things become a bit difficult. Like in some other examples, there is a child who was born of IVF, and when people come to the house, then they start asking, when the child is there already, this is psychological trauma to the child, even when the child doesn't know. So that stigma is just too much in the context of South Sudan. Like you are telling, hey, now this baby is so beautiful, she looks like a bizra, you see, like a seed. So these are some of the things which are there in South Sudan. So the stigma is just too much. Now, finally, if there is infertility, the last resort is adoption. And adoption is the worst thing in South Sudan. Even if from baby, people are coming to visit and they start asking, and they think the baby doesn't understand, but this child also gets it. And I'm just wondering, why should people be asking? Why can't they just leave up to the parents to tell the baby whether you are adopted or not? But people start like saying, even if the parents have accommodated the child, it's still from the relatives. Adopted? So the stigma is just too much, and people are dying in silence. They want a child, they cannot adopt, they cannot do IVF, they are just there. So I think that is it. Yeah.
Dr. Idera, I think you've answered like some of the two questions we were talking about. Some people are very concerned about this IVF, and they feel that there might be some consequences and effects of some of the treatment that are used for infertility. What are some of these consequences and effects, and how can this be prevented or managed? especially when it comes to about preterm delivery, which seems to be very common when it comes to IVF? How can that be sorted? And is surrogacy an option? Is this something that has been heard of in South Sudan, and what is it?
Okay. Surrogacy, let me start from the last one, then I come to the first question. Surrogacy is actually something which is going on all over the world, except in South Sudan. Maybe people have not heard of. People will start asking because, like, if it is my sister and I want to be a surrogate for my sister. Now, the thing is, you are married. How do you carry a child for someone else? You are our wife. You know, it makes things very difficult. From your husband's side, nobody will allow that because already they own you. So you are not that free to decide and help someone else. But surrogacy actually can be the best option, whereby you choose someone. I will always say if it is a close relative, is better because they will carry the baby and then give back to the mother in good heart. But like in Kenya, there are some surrogate mothers. They are available and they are ready to carry other women's children, and even the law has already been passed of how to handle surrogacy when it comes like for us for delivery. They come with all papers from the lawyers, and you know what to do. Immediately the baby is born, the baby should be registered by them, biological parents. Maybe you have the egg is healthy and the sperms are healthy, but the problem is the uterus. The uterus cannot carry a child. So there is someone with a uterus which is not even in need of it now. You can help a sister with that. So I think we should also take that idea of helping others in terms of surrogacy. Now, when it comes to surrogacy and IVF, all right, and IVF. Now, first of all, these things are all very costly, and most people will not be able to afford. And when you compare between IVF, surrogacy, and adoption even becomes more cheaper. But now the problem is whose child it is. So again, when you one of the consequences of IVF is multiple pregnancies. Because most of the time you can implant, the law says you don't implant more than 2, but you can implant a maximum of 3. So in case all the 3 can succeed, the complications with multiple pregnancies also another nightmare. And most of the time, that is why people usually go to a maximum of 2, so that at least if both 2 survive, managing twins is more easier than managing triplets or quadruplets. And again, you might, during the process of the treatment, you might get ovarian hyperstimulation, because actually the stimulation is to get multiple oocytes to increase the chances of fertilization. So in the process, multiple follicles or oocytes will grow. So when you have this ovarian hyperstimulation, it gets to a syndrome whereby you get renal issues, renal failure, diabetes, and God forbid, it is just terrible, but at least it's not so common. It occurs in less percentage of women undergoing IVF treatment. Now, after fertilization can happen and then it becomes an ectopic pregnancy. That is also another disaster. If it is ectopic pregnancy, now the management is termination. Surgery should be done and to stop where they are, to remove that ectopic pregnancy. And there is increased risk of miscarriage even after IVF. Before even it fails, you might get miscarriage. And with IVF, as I've mentioned, there is chances of multiple pregnancies. This increases the chances of premature labor, and you get prematurity and premature death, also which comes with other complications of prematurity. And again, in the literature, some children born out of IVF, they tend to develop cerebral palsy and there's learning disability, although most of the children are okay. Yeah.
Thank you, Dr. Idoro. So basically what you've described is that it can be a very, very tough and challenging journey. Of course, as with all medical interventions, the outcomes are not always the same, but we are happy to say that most of the time the outcomes are good. And for anyone who goes into, you chooses that option of assisted reproductive technology, then they have to be aware that preterm delivery is a possibility, multiple pregnancies is a possibility. So they have to involve multiple, many doctors and many specialties, including pediatricians at the onset. So we'll go to Lily. Lily, Dr. Idoro has talked about surrogacy, and for those who don't know, surrogacy basically means that another woman carries your baby and to term. That's basically what it means. It's something that has not really been completely accepted like in our society, especially as Africans, but it's something that's practiced a lot in the West. Lily, have you come across any legal or ethical issues that have been associated with adoption and surrogacy? And after you give us that brief overview, maybe you can give us some more information on what cultural and societal factors have affected fertility, and why is it that women seem to be the biggest targets of stigma, and if there's any relationship that gender roles have with fertility and what the impact is. So legal and ethical issues with adoption and surrogacy, cultural and societal factors that affect fertility, and the effect of gender roles on fertility, and if that has changed over time. Lily. Sorry, Lily, you're on mute. We can't hear you. In the interest of time, we can sort of reduce our explanations a bit, but
Okay.
Thank you so much. This is a lot of good information that's coming through. Lily,
Yeah, thank you. I think as my sister already explained more about it, I'm just gonna go straight to adoption. With our case in South Sudan, adoption is not really something which is really common among ourselves. We, though there are few that we normally is not kind of adoption, but if you look at it in the Western part, it's just adoption because your uncle takes you and raises you up, or your auntie takes you and raises you up. So that's the system, but it's still you're given chance to go visit your parents, or your parents visit you, and you actually remain within your community. You don't go out, or you don't integrate into a different community, which is what is commonly practiced back home. On the side of the legal part of it is I try to do research. It was not it gives me different pictures. But however, mostly in terms of adoption, it's mostly done, the process should be actually done in the interest of the child or the youth who's supposed to be adopted by both parents, the adoptive parents or the biological parents. If there's an agent who actually trying to connect the two parents, that's the adoptive parents and the biological parents, they should make sure they give all the correct information to the both parents. For example, the biological parents have to give the full information about the background of the child, the identity of the child, or the society where the child comes from. And they actually, with the honest and with the interest of the child, every information must be prevail in order to have a very transparent process of adoption of the child. The other thing is, again, when you're adopting a child, you should also ask the child. It's not just like it's done between the adoptive parents and the biological parents or the agents. They have to involve the child within the process, whether the child accepts or not, because at the end of the day, it's the life of the child, it's the choice of the child. What is good for the child has to be done in a very transparent manner. And in more, it's at times like if the child is going to be integrated outside the country, for example, they have to make sure where the child is going. They have to identify the community where that child comes from. They have to make sure they connect the child to that community so that the child doesn't have like that stress or maybe missing the parents because the child lived before with the parents or with the agent, because the child has the right to know the origin of where he comes from or she comes from. The other issue is like when it comes to terms of the adoption, I assume that it's done in the terms like they have to pay some money in the process to get the child either to the biological parents or to the agent, but the agents have to really come up transparent and say, oh, this is what we are getting in exchange of the child, and the parents has to know, and they have to actually work together with the biological parents of the child for the interest of the child. And two, they should also not put the child as a commodity. They're not selling. The child is a child. A child is a life given by God. So we cannot just because we want to give a child or we want money and we have to give a child in the exchange of money. That's roughly, I would say briefly about it, and just to save time. But literally in South Sudan, I've not seen any legal because it's not really common about among ourselves. Even like the voluntary adoption, I can say we do it just like the way I explained it before, but it's not really the practice we have back home. The other side of surrogacy, it's a method used, as you said, and it's used in Western world. Like, for example, here, if the couples cannot conceive, you can either identify a fertile female in the community who can accept in exchange of money. It's a contract signed between the two parties that I'm signing this contract. This is my baby. I'm going to do it, but it's going to happen A, B, C, D, and you have to sign that contract before you accept it. So when you go into a contract, automatically the child you are carrying is not your child, because at the end of the day, they take care of you until the time of delivery in the hospital. So when you deliver in the hospital, you end up with the child to the biological parents, and you end up going back home, which at times it's easy, but it's, to be honest, it's not really. At times there's a lot of implication in this. And as I said, it's not yet. It's yet to reach South Sudan, because I don't believe that, because it has a lot of implication from the society, because they say, oh, this is not your child. This child was conceived by somebody else. And even the person who conceived, they say, oh, you receive money in the exchange of a child. So you'll even be worthless. You'll be shameless in the community by like somebody has used you. You have used yourself to get money in exchange of a child. And a child is not bought in the market. So those are the things that I can talk about it in the legal part of it. Then you were talking about the cultural society.
I was asking about whether gender contributes to fertility, and in what way. If you can give us like 1 minute overview on that as we wrap up. Thank you.
Okay. In terms of gender, mostly the women's lives actually interrupted a lot. They have a lot of disgrace from the community where they live. Like if the woman is infertile, she takes every blame on her. And even in the house, the husband at times may not even accept his weakness or accept that maybe he's part of the infertility, but everything is put on a woman, and the woman carries all the burden, the stress, the trauma, whatever it takes with it, compared to the man. But although men do go through it, but they don't speak about it, they don't show it outside, but when they come to the house, you see like he becomes so rude in the house, but that is something he's fighting. Emotionally, he's fighting it, but he don't want to show outside. It's only the wife who knows. If the wife wants to talk, even if she does whatever she does, he sees her like she's the one bringing the problem. He doesn't seek really the solution that is maybe all of us have to do it. So much of the stress is carried by us women, because everything done about infertility, they see us, we are the one, because it's like we have not raised the offspring. The woman is supposed to come today after Iris. You have immediately after a week, people are expecting you to like start vomiting, like my sister was saying. But when it doesn't happen, they say, oh, marade jibumi when, which is not true. And the other one is like at times the blame is like they think infertility is just a behavior, which is like it is practiced, or at times it's like influenced by our social norms or our beliefs, especially our cultural traditional beliefs, because people put like, oh, it's only women, it's not about men. It's more of reproductive part of a woman who cannot give birth, but it's not a man. Then you see also like at times in our society, women have been blamed by our own sisters. Like when you are married into a man's home, your sister-in-law, if you have not given birth after 1 month, 2 months, they will become and say, oh, arusa de mama wale do, tara de mar de sake jibu weli lugo bes misharo map der wale do. There's a lot of pressure will be on you. But in most cases, you find this woman is very strong. She hold all the stress. She's still having life. But with a man, he will never talk. He will never even go. After work, he comes, is inside. He will never come out. The other side of like the contraception or the abortion, if they have heard that this woman, maybe before the marriage, she had an abortion, they will all say, oh, Ashande, they like it to fisika. So they put all those issues on a lady. Even if this man who have married the young girl today and both of them have not conceived, he will not even think about himself. How old is he? Since he started coming, is there any seed that he has thrown somewhere? There's nothing. They don't even talk about it. They think, oh, how old? The man is in 40s or is in late 30s. They will say, oh, for him, he's okay. But it's a problem with the girl, forgetting that he's the one having problem. And at times when the two come together, you find a man can have a problem, but he will not open up to the wife and say, oh, sister, I have this problem. Before we go into a marriage, we need to go and seek medical attention. I've been having girlfriend, but I've never even have one who had miscarriage. Maybe I might be having a problem. Can we sort ourselves before we go into a marriage? But the man will keep quiet and will bring the woman in. When you don't know anything about someone's health, then it becomes a problem. The both side is like the reproductive system is always blame on a woman, not a man. Even when it comes to decision making, she cannot take decision because she has not given birth.
Yeah.
Then when she comes home, she has to give birth to the race, because the race has to continue. Once the man has not given, when the woman has not given, it's like, oh, they jakatul de kalas katulanna usratanna kalas gimutu maran magder wole do. A lot of issue on this woman. And at times you find that the effect on even a woman is more greater than a man, because sexually she will never get satisfied. Because when time comes to the sex, the woman is so scared. She's like, even if I go for it, there's no child. And at the end of the day, in the morning, I have that shame and she feels guilty. And yet it's not her problem. And at times the man will not even, he will lose his interest. Like when they go for sexual intercourse, he might not even release in time. And again, just like what you were saying, the guy was living in a different place, working for 10 months. When he comes, maybe that period was not the safe period. Then he ends up blaming the woman. He comes only for R&R for 5 days in the house, and that 5 days is not the evaluation period. She ends up not having a baby. They say, oh, this is the woman. She doesn't give. Even in their family, they don't give birth. So in gender perspective, that's what the blame is all carried. Every part of the blame of infertility is blame on women compared to our counterpart who are men. Though we are in the same boat, but the society focus more on female than men.
Thank you. Thank you for that explanation. And I think also some of the things that we should also look at is the fact that if women are also not empowered, they cannot really make many decisions about fertility or treatment of infertility. As Dr. Idoro has said, that some of these treatments are quite expensive. And if your partner is not on board, or if you're not economically empowered, then that becomes a problem. Now, in terms of the definitions of infertility, most of us would describe it as something that can be caused by a medical condition. However, there are many definitions. The WHO defines it as a disease of the reproductive system that is defined by failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse, which is what Dr. Kiden had told us. And in another definition, it is the inability to become pregnant with a live birth within 5 years. Live birth means a baby who's born and breathes and continues on to develop within 5 years of exposure based upon a consistent union status, lack of contraceptive use, and non-lactating and maintaining a desire for the child. That's a bit more complicated, but we will go with Kiden's definition. Now, we would like to wrap up the conversation. So I will give a chance to Benna to basically maybe just tell us how counseling and psychotherapy helps individuals or couples when it comes to infertility, and what strategies are used. And then we will go to January, who will talk a little bit about obesity and being underweight, and then we do the conclusions, challenges, conclusions, and recommendations. So, Ms. Benna.
Yes. When we come to the issue of counseling, sometimes it is very difficult for people to understand what is counseling. It depends on the background of the people, the environment where people live. To come to the context of South Sudan, counseling has been one of the unknown services within the human society. Though we all, cry that we need people to talk to. And then at the professional perspective, we always see that there is a need for people. There's a need for people's problem to be adhered. But it is really very difficult in South Sudan context to understand the importance of these counseling services. To the issue of the infertility, actually in South Sudan, I'm happy that Dr. Idoro was telling us that they have this program for pre-counseling before any investigation has taken place and all that. To my surprise, in South Sudan, there is nothing of that kind. Though there are some medical doctors who are trying to get some information about how to counsel the patient or the couples who are going through the issue of infertility. But that kind of, counseling is not up to that, context that we prefer for such situation that people are going through. We know very well that counseling deals with with, like, for instance, you hear the problems of human beings or the people, or also you help them how to come out with solution in their problems. Having said that, all people need somebody to talk to. Can you imagine that if you're angry, you wanted to share your problem with somebody? That's the process of counseling. But who is that person? People fear to go to counseling session because they think that their secrets will be exposed. But mind you that counseling is not to that action because there is an ethics to that. Importance of counseling in the issue of infertility has a lot of weight. Example, for instance, when we go to counseling session, when we're using a lot of techniques in the therapies and all that, like for instance, this type of counseling techniques, like for instance, CBT or cognitive behavior therapy, it helps that individual, to identify the challenges that he or she is going through. It will give that room to understand your own problems. Like that, no one will give you such kind of a technique or such kind of approach and all that. It's only from the professional persons. Therefore, when we use counseling in this issue of infertility, it will help a lot because many people have undergone through distress, depression, and a lot of anxiety. Like this one, a medical doctor cannot handle such kind of situation. Therefore, like for instance, accepting the situation. Who will tell you that acceptance is one of the important coping mechanisms or the strategies is the profession, who is a counselor. Therefore, when we come to the community, services, we need also to talk to them about the importance of the relationship between giving the medical services and such psychological services so that we meet the need of our people. To come down into South Sudan context also, I think if there is that need, If there is a doctor beside or to the left-hand side, should be a counselor to help that. Or we need the doctor should be trained of how to give that professional counseling, if it is going to be pre-counseling or post-counseling after the investigation. It is really very important. We have a lot of good, therapies, techniques of how to handle different psychological problems, especially when we are coming into the issue of what is infertility. When you don't accept your situation, do you think that you will cope? Do you think that you will have that hope that, inshallah, in the future will have that child? Any woman wish to have a baby. Any woman wish to breastfeed. Any woman wish to work with a baby. But situation comes across. Who will give you that future? Who will give you that hope? Unless you accept. And who will give you that meaning of acceptance? There is a certain, phenomenon in South Sudan, especially in Juba. People are running from church to church, seeking for help, spiritual help. But mine, I do look into it into psychological perspective. I know that their minds are not at rest. They are in conflict with their minds. When you started to believe is one of the coping mechanism or a strategy. When you started to believe, definitely you accept your situation. Then from there you find out your stress is relieved. You are not depressed anymore because you believe that there is that God who heals. There you find that in 1 year, the woman is pregnant because I went to that church. It is not only that church, it is because they believe the mental setup is made up on that belief. And belief is one of the new coping mechanisms that, yes, I have it. And today I can see a lot of results concerning, using this coping mechanism, like beliefs, acceptance, and all that. And this one, all you will find them in the counseling sessions. And with the help of the professionals, you get that help.
Thank you so much, Benna.
We manage this, depression that we are going through, the worries on that. We women, sometimes we don't adhere the issue of the sport. We don't make exercise. We need to renew our energy all the time. We ignore this because we are ever busy in the house and all that. We also advise you people that we should go. Let me just tune again into Arabic, please, I beg you. This message may...
I'll give you a minute for that as we wrap up the conversation.
Great. I think I will stop here. Thank you.
Benna, go ahead. Give a minute. I've given you a minute to talk a little bit in Arabic for those who will understand.
All right. إخواتي القاسمانا في برنامج تنة infertility أو يعني زول المبادر ولد جنا. Sometimes إنك فكر قال ولد المافي ده بريجا ورا في خلفيات زول يمكن sometimes عندنا كمان تفكير البطال قال يمكن راجل ده دوره كتير ولا مرة ده كمان دوره كتير كتو مرة ولا نفرين ده ما ولدوا ولا sometimes نجي فكر قال ولد المافي ده في أسرة ناس أسرة ناس بينا ما ولد سواء تكون جيبوا في بيت ما ولدوا شكل حاجات زده بيجيبوا مشاكل في راس الإنسان يعني تكون بيجيب نفسيات لزول sometimes تبيلقوا قال وجراس كتير في البيت مرة دي لسه ما بدأ أكل مانجا ناي ولا ما ندي قصب سكر مالو جيتها ولا زدوا ما ولدوا مالو كده روح اسمع أسرار شكل حاجات زده ما كويس أكو تتاي ولا أكو تاي إتلقي جروا في حالة ده أنا ده وريلتا قال إنت لسه عندك chance إتبولدوا don't lose chance أنا ما تفاقدوا عمل قال فيني إنت خلاص ما جرا ولدوا إتجرا ولدوا حاجات كتير جه حصلوا في أسباب كتير كبير دكاترة تنونس كلام جميل قال حاجات ده كله عنده حلول ولا عنده كله solution لكن كانت بس كان قال خلاص أنا جرب واحد سنة خلاص أنا بيجا ما بولده أنا give up no إن لازم كنا نروح قال فيني نقول لدكاترة تنا براو في دكاترة بيساعدتها كيف إتبولده جنا في كمان كلام تاني جديد في ساوث السودان قال فيني يالا الزراو بزراو ما بيجيني يعني بيجيني 30 سنة بس بيموتوا توالي التفكير هو غلط كلام ده كتير بيونس في راديو كتير قال جنال ذاته جه زراو بزراو ده او ذاته جنال ولدو بولدو عن طريقة تا صلاو جنا ده بس يفرق أزول ده كان متبي وتاني ده بس ياو جيبوه بطريقة تا ميديسين لكن الجنا ده بيجي زي أي زول كان الله دو زمن ده وبيجي 100 سنة إن شاء الله لكن التفكير وكلمات اللي بيجا في راس تشويش اللي بيجا من برا قال في جنا ده is a fake child ما في زول تاني مزور في الدنيا دي كان انت فقد عمل قال انت ما بقدر حامل طبيعي زي ما كبير دكتور انا تقولس قال في كمان طريقه كيف جنا بيكتو في جسم تمارا قالوا شنو بيزرعوا جنا دي جنا لو زرعوا او ما فيك جنا ده او انسان زيك وبوجود وبجوز وكمان بولد عادي زي ناس تانيين فالتفكير انا بزر وري لك قال كنا ما فقدوا عمل انت بيجينا 10 سنه لسه تبدا ولد انت بيجينا 20 سنه نعرف قال نسوان كمان زمن دوم غروا نعم معلش لو زمن تاكل كويس جاء او بيجا لو الفوت ده كمان ما في مشكله كمان كواجد قال ايفن مره في 60 سنه بزراجنا في بطنه الدور وولده ده ما بطل كنا حاول فرق تفكير تنا الجيجا البطل فراس اللي يمكن بيحسر بانسان ثاني كنا حافظ كلمات الجيتنا من لسان تنا كيف because كلام الجيتنا من لسان ده بيجرحوا الزول تاني أو بيجيبوا فرح في حياة الزول تاني. I think I will end up here. Thank you.
Thank you, Benna, and thank you for using Arabic, which I can understand. So Benna has basically reiterated what Dr. Kidane had talked about, and what she's saying is that we need to think about how we talk to people who are affected by infertility, that our tongues and our words can actually hurt them very much in terms of what we say, and some of the things that are said are based on myth. The fact that some people think that children who are given birth to through in vitro fertilization, where the baby is put in the womb, are not normal human beings. But the truth is that they are, and they grow up, they become people of society who are able also to give birth and have families. And that some of the things that are associated with the stigma are that sometimes we even say that certain women from certain families, they come from families that have not had children, and therefore we associate them with infertility, and people complain that these women should not be brought into the family. So basically a few of the things I've picked up. Thank you so much, Benna, for mentioning all those things in Arabic and also summarizing what almost everyone has said in this forum. Thank you for also mentioning that those children come out the same way as all of us who are given birth to through normal sexual relations. Those children are human beings, and they will do everything that any normal human being is going to do at the end of the day, and that is something that people must remember. So Ganiri, maybe you can give us a brief overview of the contribution of being either overweight or underweight to infertility, and then you can give us some of your advice in terms of diet and your conclusion and recommendations as we wind up. Thank you.
Thank you so much. Okay, before I would actually go straight to the overweight and the underweight, there's something I feel we have left out. It's about the substance and alcohol as a particular, because it gathers a lot of issues. One of it, as we have talked about the STI, Dr. Kidane talked about STI. So alcoholism or taking of alcohol sometimes expose a couple to STI. You know, when you're drunk, your behavior changes. So we should also take alcohol as a big culprit in infertility. Apart from the STI aspect, we know very well when somebody is drunk, they may, maybe if it's the man, may just come back home and sleeps. Yet that is a time when the lady has ovulated. And I believe maybe the egg is just 24 hours. You know, and this is when the guy has just come and slept. Oh, that's when the woman has come back from drinking and actually has just slept off instead of working for a baby. We have also seen the alcohol also changes their behavior maybe into violence. You know, all the time they are quarreling off and on because of somebody's behavior of drinking alcohol. It may also somehow indirectly contribute to infertility. We have also seen alcohol. I really felt there's a lot of indirectly affecting fertility in the aspect of nutritionally, where people buy alcohol easily than buying something healthy to eat. You know, a man will go and drink, but just gives maybe 2,000 SSP in this current economic status right now for a lady for a family, but will go and drink maybe 10,000 out of 20. You know, it also defines the family's well-being or nutritional status, you know, as a habit of alcoholism. Now, when you look at alcoholism, it actually eventually goes to the overweight, you know, that we have seen. Then that's when I will now talk about some aspects of the overweight briefly. It mostly, we have known very well there's a society perspectives of somebody who is overweight in sexual life. Some people say, oh, they're not so attractive like the slim girls or the, you know, the sexy boys with muscles. So it somehow also affect them psychologically, that I'm now so fat, or so my wife is not happy. So maybe you say, oh, you're so heavy for me. Or maybe the woman is not sexually attractive anymore because of her weight. But also medically, we know very well it affects the sperm counts. It may affect their hormonal imbalances in the body, overweight. In women, it may affect their menstrual cycle. We have known very well. Just briefly about the overweight. So when talk about the underweight and anorexia, we know very well anorexia is a eating disorder where somebody decides to lose weight, again unhealthy. They literally cut off calories. They literally stop eating, or they eat and try to bring it back. You know, vomiting, using enemas, or so they all excessive exercise just to lose weight. So in the process, they're affecting their health, and the body. So they deprive their body from nutrients. Maybe just like the way I was talking about alcohol, you drink, then you end up vomiting all you ate, or you don't even eat at all, you're just drinking. So in anorexia as well, their body is also deprived of nutrients that maybe will lead to conception. And as your body is also shrinking, sometimes the period stops. You know, menstruation stops literally in anorexic patients. So which may also affect fertility. And also, Dr. Adil has talked about supplementation. So sometimes the zinc you have taken through eating, you end up missing it even from the food, because you are trying to lose weight, you know, in anorexia, or you are malnourished. So it's really, it all ends up in having things to do with hormonal changes, low sperm count, menstrual changes in menstrual cycle, and, you know, and even ovulation. Also, the DNA of the cell is also affected by that condition. So since for me to conclude, for anything of to do with nutrition, there are simple aspects that we normally advise. A healthy lifestyle, eating a balanced diet, fruits, vegetables. I don't know a stage where I will ever tell a patient that stop eating vegetables. It's always healthy to to almost all patients, because when you're diabetic, or, you know, it's all healthy to start with what comes from a plant compared to what comes from a factory. Then, so having a balanced diet, exercising healthy, not the way those with eating disorders do, the anorexic patients, how they exercise hard. No, here we are exercising healthy to keep a healthy weight. I would also advise something maybe we might have forgotten in our discussion about radiation. A man maybe putting a laptop with all the radiation on his laps. We know how it affects the sperms and all that. And also the cell phones, where they place the cell phones. So we should also try to avoid radiations. And also in the society, pesticides and insecticides, to try not to give it closer to our ingestion, maybe washing our fruits well, soaking them, vegetables and all that, and maybe spreading the house only when necessary. At least in the circle of South Sudan, most of our foods grown are not really that kept with pesticides. And also we should also try to educate our society to be fair in what they eat and stop being not really stop, but try to appreciate the fact that we should not be picky. Eat what is available. We don't have to eat only the tradition of what we know. We also eat anything. You don't say, matoke is for Baganda. Oh, this macaroni is for lazy people. No, if that's what is available, we can try to also eat it. And we have also seen our tradition. Some traditions, they have herbs they give men and women to enhance fertility. So it's always good to match that too. If you have the herbs, you may consult a doctor in case of the side effects of the herbs, but it does not stop you to take it, because as long as it doesn't kill, or when 2 or 3 people have told you this helped me, it's just a plant anyway. As long as it doesn't give you instant side effects, it may not really have much use, because long time ago our parents used it and it actually helped them. Then other behavior like smoking, coffee, too much caffeine, this processed drinks, we should somehow reduce it, and also reduce on our sugars, maybe for a better weight or to combat the infertility. And serious counseling to girls earlier to prepare for what it is, for motherhood. It doesn't have to be the last minute, but they have to always know what motherhood is. And yeah, that's what I could conclude with. And thank you so much.
Thank you so much, Ganiri, for that information that you shared, and also for talking about substance abuse and its contribution to infertility and fertility issues. I think that's something that it was important for you to mention. Thank you so much. And also for the advice on the nutritional aspects and on preconception nutrition and starting early when it comes to planning for motherhood. So we are going to go to our final round. And I would request each and every panelist to give some of the challenges, the conclusion, their recommendations or advice, and the conclusion. So we'll start with Dr. Kiden. Dr. Kiden, if you can give us some of the challenges when it comes to that have been associated with diagnoses of infertility in women and men, and what your recommendations and conclusions are.
Thank you very much, everyone, for all the contributions that you have been making. They are so enriching. Diagnosing infertility is usually a very expensive phenomenon, or even the treatment of infertility itself, as Dr. Itiora had already said, that this is a very expensive treatment that the woman has to go through, or the man has got to go through. So the challenge is there that the monies are not always there. There are no finances. And so already, as we have already seen, that there is a lot of stigma in the community and at the family level, where you are not able to give birth, and here you are. Your treatment requires that you go for investigations and treatments that are expensive. Most of the time, the response is that this woman is wasteful. She cannot. There is no need. She's very useless. There is no need for the family to spend more money on her, given the fact that she is not even giving birth. So that is one major challenge, that will keep this couple away from treatment or investigations that are necessary to diagnose where the problem is. So apart from the fact that the money is not really usually there, but also the attitude towards it is what is important for us to note here. Then another important point that I can make there is that, including those who are people who are listening to us, that infertility is not a choice of anybody. That somebody would want to be there that doesn't want to give birth. As you have seen, usually the stress that it brings into the family, and therefore, whether it is you who is affected or your neighbor, whoever it is, whether a friend, you deserve to give this woman or this couple your due support that they really need. A lot of psychological effects. So please do give our mothers a lot of that support that we need. The other thing is that from the challenges of diagnosis that I can see is that the services are not available most of the time, more especially in Africa, or in particularly in South Sudan, that we don't have these services. They are not available, and access to these services is also very, very poor. Then even when you go there, sometimes the quality of the intervention is not good enough to offer hope and the desired outcome as to why you have gone there. So that is another challenge that we have in availability, access, and the quality of the services for infertility are not there. The other challenge is that there have been the governments have not really, worldwide, they have not really placed a lot of priority in treating infertility. They look at it as an individual or a family matter. And so they have not put a lot of inputs and the resources that deserve to go there. So in their policies concerning the populations and the development, the policies are not there. So therefore, the populations are left in a vulnerable state, and therefore they cannot progress. The other important point is that the personnel, specialists in infertility, are very, very few. They are very few, and if they are there, they are in big cities, and if they are in big cities, they are attended to by people who have money. So that is one important thing that we should also know, that the personnel is not there. Other than the personnel can be there, but the equipment, right, the infrastructure are not there. And so at the end of the day, the issue of infertility is still with us a little longer than what we think, right? So what do we do? Let our governments wake up and begin up to put up policies that promote good reproductive health. One of the causes of infertility, it could be that it is resulting from complications of childbirth, all right, complications of abortion. So if it is not done well, at the end of the day, the uterus is perforated, or the curettage is overdone, and the adhesions take place, infertility sets in, and yet these are things that we could do at the governmental level or at the Ministry of Health level, such that we can avoid such complications. Another complication is, which is very common, is that when the woman is giving birth, she develops obstructed labor, she ruptures the uterus, and then the uterus ended up being removed out. The baby has died. Maybe it was her first pregnancy. The baby has died, the uterus is out. You see, so at the end of the day, the reproductive health services are very important to be put in place such that our women can go through childbirth smoothly. All right. The other important thing is, as we had said on earlier, that we should be able to treat STIs very promptly and make sure that you attend to your partner as necessary. Importantly, the other thing is that, as I conclude, that we need to give a lot of psychological support to anybody who is experiencing difficulty in conceiving a baby. It is not anybody's choice to be like that. And so, actually, the more psychological support that we give, we increase the chances of her conceiving. But when you stress her by telling her a lot of bad things, more stress, and then the hormonal imbalance comes in. For the man, the libido goes down, everybody is confused in the house, marriage becomes a difficult phenomenon. And so, psychological support is very important. Somebody had asked whether infertility is a disease. Technically, it is just a consequence of something that is occurring within the woman. All right. It is a symptom, it is a manifestation of something that is going on wrong. And therefore, if that is the case, then it should be treated like any other disease. All right. This, just as you can take somebody for malaria treatment, take this woman with infertility for malaria for treatment. Just as you can treat typhoid, the same like that. Any other disease condition that needs attention, the same thing with infertility, that it should be managed properly, and it deserves all the support of everybody. Otherwise, thank you very much for having me in this discussion. God bless.
Thank you so much, Dr. Kiden, for that explanation and that conclusion. We are grateful to have you on the panel. Lily, if you can just give us some of your recommendations and conclusion, especially when it comes to societal issues with stigma and support of people who are affected. Lily, if you can unmute yourself, we can't hear you.
Sorry. Thank you very much, Anne, and everybody. I'm glad to be part of this panel today. My recommendation is just on the couples, like the society. We have to look at our sisters, our brothers, to be like they are one of us. We have to, it's all about love. If you love yourself, then definitely you will not put one to become a victim, neither a brother or a sister. This situation is there's no one, as you said, who wants to be in. But again, I would plead to the doctors, please make referral, if possible, to affordable services. Again, my sisters and brothers out there, please speak out. Don't die silently. If you speak up, you will always get help. You will be assisted in one way or the other. There are resources out there. I know we don't have it back home, but when you speak to a friend, you never know. You might get help and you might be safe. To my brothers, your wife, you loved her from the beginning. Love her to the end. Please, that's not her own making. Please, that's not your own making. God gives life. And if you don't have it, please don't put it on the woman or on your husband. That's not the end of the life when you don't have a child. There are your sisters out there. It's just a matter of getting that child and give life to that child. Even if you give birth today, if you don't raise that child, if you don't give good life to that child, you will never be happy, you will never get satisfied. Like any other child, if you get that child and give life to that child will be yours. I'll give an example today. Kiden, and I don't think you are in the hospital treating people. Are you treating only your parents? Are you treating only your immediate families? No. So it's the same way when we give birth to the world. And just go and help the world. It's not necessary our children. So if you don't have it, please don't worry about it. Give life to any child around you. And always be honest to your partners. And if there's any group, infertility group in your community, please join it. They'll help you. I will also plead to our government to provide education, because at the end of the day, we are wrapping up with education. We don't have the providers. Why? Because we are not educated in South Sudan. There are people down there in the village who cannot even speak the Arabic of Juba we speak today. How will they get that education? We need to have education to create awareness to our society. Again, our sisters, don't be so mean to your sister when she has not given birth. Put yourself in her shoes. How will you feel? Respect her, even if she's your in-law, she's your sister, respect her, give her time. When she's not happy, she will never, the more pressure you give her, the more trauma she goes on, the more system shut down, and she will not have chance to conceive. Please give chance to her. Life is given by God. Thank you, and Happy New Year to all of you.
Thank you so much, Lily. Dr. Idioro, if you can come back on screen. I know you are at work. Give us the challenges associated with treatment and some of your conclusions and recommendations. Thank you.
I think the challenges are just the same as mentioned by Kiden. We have challenges of human resource. We don't have specialists. Infrastructure is also another issue. And to my conclusion is almost what Lily has just said. Let's stand there for each other. Nobody actually wants to be childless. So even if that is your sister-in-law, we still stand with her, because what if it is you? So I think let us help one another. And for our ladies, if you're going through the same, you seek help, contact some of us. We are available on Messenger. You can find us. You can side chat. We'll be able to advise on what to do. And there are so many options which we can be able to provide and give you some options to do. I think that is what I can say. Thank you.
Thank you so much, Dr. Idioro, for taking your time, even though you're at work, to speak to us today. We're very grateful for your presence on this panel. Bena, you will conclude for us and give us your advice, recommendations, and conclusion. Thank you. Bena, your mic is muted. You can unmute yourself. Thank you.
Yeah, thank you for the chance. But dear listeners or the viewers of this program, hence we come to the conclusion of this program. But what I would like to say that life has a lot of expectations. Sometimes also we have our own plans and the world gives us its, results. My brother and sister, there is something that I wanted to tell you. Sometimes you don't understand, or maybe you don't, think that it is really helpful. There is a say that if somebody slap you, you give the other side. Or if somebody just slash you with maybe fire, you just slash that person with milk. What do I want to say? We have a lot of languages that destroys our mental capacity and how we react to our problems, different problems in life. We know that our society got no any positive, reaction towards infertility. But yet, I wanted to tell you that if anybody says something bad to you, you have to be positive. Positivity in any problems gives you good reaction, and you will be calm. We need to be out of stress, because stress has a lot of bad impact on our health, not only in fertility, also in our brain, also in our body, also in our settings of life. Today you might be maybe 10 years or 20 years searching for a child. Acceptance is on your way. My sister and brother just say, okay, it is me. I've accepted it. You are a father to everybody. You as a woman, you are a mother. You have your niece, you have your uncle, you have your auntie. Consider them all your what? your children. Accept your situation. Suppress the pain that you're going through. I mean to say you ignore them. I know it's painful, but try. You know, life is full of trials. If you don't try, you will never succeed. Use acceptance and suppressing as two of your coping mechanisms in your situation. On top of that, as Christians also, we are asked to accept the reality about anything that happens in life. So prayer is one of your coping mechanisms. Pray. I can see we love God. Continue to pray. There is nothing impossible with him. As you believe, things will be fine. A lot of people behind you died without children, and yet they are loved by the people who are their relatives, even non-relatives. They are in love with that person. Why not you? Just continue to believe in the God that you are believing in. My recommendation goes as follows. I wish the Ministry of Health is here in this forum, or maybe she is following us. We need to look into this issue in a serious mind, because outside there is not good. It is really very painful for a concerned citizen to see every day, every man, a woman, and a man is seeking for help in the same issue of infertility. And yet there is no facilities. There are no professionals or specialists. Yet we graduate every day people from the universities. Where are those specialists? Is there any sponsorship or scholarship for those? I know it is a very difficult field. I wish the government should also open their minds to give another policy that support, the generation, to give good mentorship in how to select their profession in medicine. What the country is lacking is what we want. Our brothers and our sisters are suffering. As I've said in the beginning, that infertility in South Sudan is another second or civil war, because people are suffering. If your sister is not giving birth, you are also a secondary traumatized person, which means the whole family is not happy. The whole family is sick. Ikhwata wa akhwata algasmaina kalama anna ganonu sude da hayat algi hasa fi mujtamatina. Haja lina gano ka khulasa ta baramij da innu mashakil fi iya makan. Mashakil ta walada da o fi. Now, even fi kitab al-muqaddas al-tangagara, yumkin fi Quran bigul, fi nasanin salamun ma biweledu, fi nasanin salama bijozu. Yes, ana ligo fi kitab al-muqaddas bigul kida. Lakin, ita al-gifetu sujena mid sena to come, ita lisa gifetu sasede, kurata ke waja bedingiru le salawat. Ana gasa dita gal istemir, don't give up. Rudu hala alita fi fogode. Because ma fi haja tana alta baamul fi dunya de. Lakin kaman ma dururi gal aya haja bes ita basma fi kalam ta shunu ita ma indu jena. Fi hajat ketiri ta baamul. Fi nas ketiri uruba la umun ma bagir weledu ma ge fata mahal ta yal. Ubijibu yal al mendu umahar mendu ma buhar musharidin fi shawarida. Ubijibu be hafis de lo grush fi inkania lo fi jibu mon be busy with them. Alive burua kwis kanita mafikir fi single concept. Kanina geni kutu rasina bes gale yes ana ma weledu wala irize ma kwis. Irize gura kwis. Lakini yom fi al aya haja bifata leta. Kutu gelba take tehed, rudu hala leta fi fogo, waseli ketir. Aya haja bikun mustahil fi hayata take. Umata asma kalamata nasal bonus anaro mujtama tena ma kwis. Lakin kamana nagasa dita kan mara walita raji dita kama ki contribute for depression wala stress wala anxiety la nafs al mindum imkania asan kefu bilgo yal ita kaman ki stemir le destroyer ta community de inna darita kun kama kede kun a source of peace. I don't mean the physical peace, I mean the mental peace. All of us should contribute in building peace within ourselves, and this come when we analyze any single words that come from our mind. because when it is being uttered out, then the brain takes it automatically. So let it be a peaceful wording. Let us help our brothers and sisters who are suffering from infertility. Let us try to psycho-educate them in a healthy way, how they can deal with such kind of problems in their life. We continue to fill their shoes so that in the future we'll be one and contribute for the welfare of this country. Thank you.
Thank you so much, Bena, and thank you to all our panelists, Lily, Dr. Kidane, Ganiri, and Dr. Idioro. It's been such an eye-opening discussion, and I can actually feel the heaviness of what we have talked about today. And what has come out very clearly is that we as a society have something to contribute to help those who are actually experiencing infertility, and we can be drivers of positivity instead of stigma, and that we implore our government to build the capacity for people who are affected to be investigated and to be treated. And that is, it is up to us who surround these people to lift them up and support them. Now, since today we're having a discussion that is mostly medically based, we would like to just have a moment of silence for one of our colleagues, Dr. Elsa Bojo, who passed away in Nairobi. If we can just have a moment of silence in remembrance of her before we conclude this discussion. So just a few seconds of silence. Thank you. Thank you so much, Dr. Elsa Bojo. May you rest in peace. We celebrate your life. Thank you so much, panelists, for joining us today. And thank you for this discussion that we've had. I know people will have a lot of questions. Please feel free to go back to the Facebook page and YouTube to answer the questions that people may have asked that we have not answered. And we will have further discussions for those who want a progression of this, the information that we've given here. And as Dr. Idoro has said, all of us are available to answer any questions that you may have and to direct you to any help that you may need, whether it's psychological, nutritional, so advice, and medical. Thank you so much for joining us. And we hope to see you for our next discussion on Saturday at 4 p.m. East African time, and the other time zones will be indicated in our poster. I'd like to also thank you and women for their support, and thank Aisha, who's behind the scenes, for technical support. Thank you and goodbye. Thank you so much.